HumanFactors is about enhancing productivity, reducing error, and enhancing safety for patients or staff. One case that comes to mind was a case where a resident came up to me on a Tuesday morning and said, "Dr. Etchells, last night I was trying to give intravenous medications to a patient having seizures. And I think your syringes are defective in some way because the medication kept leaking out onto the patient's bed." Now, the same morning, a nurse came up to me and said, "Dr. Etchells, I think your residents are defective because they don't know how to give injections. This resident was giving injections last night and the medications were leaking all over the bed." So we looked into that, and it turned out that there were a number of issues with that case, but one of the problems that came apparent is that there's a variety of syringes that can be used on the hospital ward. One of which was a syringe that can only be used for intramuscular or subcutaneous injections, and it was not compatible with the intravenous ports. And this happened to be the syringe that the resident picked up when he was trying to give these medications in the emergency. It also turned out that the nurses didn't like where those syringes were stored, because then they had to keep going to get them and move them to where they really needed them to be. So our solution to that case was fairly straightforward. We just took all those particular syringes out of the common area, so they couldn't be picked up by mistake, moved them to a different area where the nurses actually wanted them to be in the first place. So by making that change, we believe, able to reduce the chance of error and enhance productivity at the same time.